as they exit, I'm now going to welcome 4 other inspiring food leaders who will help us think through real solutions for urban food systems by taking a closer look at what is happening in Baltimore, Maryland, a place where I feel very privileged to live. I'd like to welcome Taylor LaFave, the Chief of Food Policy and Planning. He's the city's newest Chief of Food Policy and Planning, so I want to give him a round of applause. Lindsay Adams, who is the food resilience planner for Baltimore, and Yewande Akinkuowo, who is the food access planner for the city of Baltimore, along with my very good friend Holly Freishtat of the Milken Institute. Holly was previously Baltimore's first food policy director and chief of food policy and planning. And I also had the opportunity to go to graduate school with her. I want to thank you all for being here. While you get settled, and I know you're mostly settled, and I want to take some of this time to thank some of our other incredible partners, including Farmer's Fridge, who provided the lunch that many of you were able to have today. I also want to thank Susquehanna Mills, Nyman Ranch, Hip City Veg, the Equity Company, and Noble, whose products you will be able to find and enjoy. And again, very jealous that I can't be there during today's programming and after the reception. So thank you, Taylor, Yewande, Lindsay, and Holly, for joining us all. I love a good story. There's nothing I like more. And Baltimore's food policy sort of history has a particularly interesting story. So Taylor and Holly, and Taylor, congratulations again. I'm wondering if you can talk about a couple of things. One, where Baltimore has been in terms of its food policy, its resilience, its access, affordability, and equity, and now where it's going. So Taylor, do you want to give us a little bit of a synopsis?
Sure, and thanks for having us today. Maybe I can let Holly touch on some of the things that happened before even any of us joined the team, but one thing that we're going to focus on today is our ARPA proposal that we're really excited recently was officially approved by the city. But I think in order to talk about sort of our current and future work, we first need to talk about what we've done over the last couple years with our COVID-19 emergency food response. Because really what we've learned over the last couple years has greatly informed our plan for our work over the next several years. So just start with a couple of facts. Before the pandemic, about approximately 150,000 of the residents in the city of Baltimore were on SNAP. And during the pandemic and now, over 200,000 residents are on SNAP. And our city has a population of approximately 600,000 residents. So that means approximately 1/3 of our residents are still on SNAP today. So in response to the pandemic, our team developed a COVID-19 emergency food response, and we had been doing, and Holly and past members of the team have been doing food mapping in the city using our healthy food priority areas, SNAP data, and census data for 10 years, so we knew the food environment, and that allowed us to sort of plan a distribution network of what became over 100 sites across the city, where to date we've distributed over 1.6 million boxes of food, over 1.3 million of which we're really excited have been fresh produce boxes. In addition to that, we stood up a very innovative public-private partnership with Amazon and the Maryland Food Bank and the Baltimore Convention Center to home deliver shelf-stable boxes directly to folks' homes. That program is ongoing, and our produce box distribution is ongoing as well. All of this COVID-19 emergency food response work has been 100% reimbursed, or has been or will be, by FEMA. And so we're now at over $37 million, 100% reimbursed by FEMA.
Amazing.
I'll stop there, but Holly, I don't know if you want to touch on things further in the past.
I'll make one key point. So when I was the Chief of Food Policy and Planning, what's important to understand is what we were before COVID. we already had a team, division of food policy and planning. There was already myself. There was a food resilience planner, food access planner, and food systems planner. And because we already had food embedded in government, we were able to respond overnight to COVID-19. And it created our ability to have the connections and the social networks already in the community to be able to respond. And one other point, touching on what Taylor said, it's 18,000 produce boxes per week for the last 2 years, run by community organizations who are trusted and embedded in the community. So these are grassroots nonprofits, these are rec centers, these are schools, and many others, and they have not stopped. They have been serving the city for 2 consecutive years. So much of this work is on the hands, hearts, and souls of Baltimore City residents.
It's so amazing and so commendable, and the building blocks, as you said, were already in place. And Lindsay, I'm hoping I can turn to you now, because the reimbursement by FEMA, which is so important to the work that you do, was an incredible endeavor to accomplish. And I'm wondering how Baltimore was able to frame these food security efforts to ensure that they were recognized as part of an emergency response to COVID-19. And all of you can jump in here if that makes sense. But Lindsay, I'd love to hear from you.
Yeah, well, I'm louder than I thought. Great question. No, something that's really important to highlight here is just how much greater risk was posed on our food insecure populations in the beginning of COVID-19 for a number of different reasons. One of them being just increased risk for health complications due to food insecurity. But we also saw complications with a lot of this population was relying on public transportation, which are small, crowded, unventilated areas. They were taking public transportation to grocery stores, which were other high-risk spots for transmitting COVID-19. So we really framed this as a response to COVID and mitigating COVID transmission. And so, as Taylor mentioned, all of these food distribution sites were outdoors. We supplied PPE, masks, hand sanitizer, things like that to keep all of these populations safe. And so we were able to frame our response in such a way that we were responding directly to the public health emergency.
It's really incredible what you were able to do, and the sort of the foresight and insight that all of that you and the city had to be able to do this and keep people safe and still keep them nourished. This is such an important component of this. And Yewande, what I want to do now is turn to you, because I think a big part of this is your work and how and really making sure that the communities are aware of this work, and that different community partners can highlight what they're seeing on the ground and relay it to you. How does that work? And how do residents, talk to you all?
Yeah, sure. So I manage our food pack meetings, which stands for Food Policy Action Coalition. So these are quarterly meetings that we have with residents, stakeholders, and community organizations. And it's really just a space for everyone to come together and just talk about food security in the area and what they're particularly doing, because we want to prevent siloed work. So it's just an opportunity for everyone to just come together, and then residents in particular can also talk about what they're seeing on the ground, and then we as the food policy team can take that feedback and then take action. We also have our resident food equity advisors, which is a really awesome initiative that we have. So we had 2 cohorts in the past, and we're looking to get it started back up again. But essentially, our resident food equity advisors are, again, just residents in the area. And again, like you mentioned, they're able to tell us what's happening on the ground. What does food access actually look like? What does the day-to-day look like of having to go and get groceries, particularly during COVID-19? And we were able to use a lot of that feedback to put our emergency response together. A lot of what Holly talked about as well with the produce box distribution.
I love that so much, that residents have a direct line to the government. This is such an amazing way to sort of run how you do food access and equity, and make sure that residents are involved in every step of the way, as they should be. That should be the norm, not the exception. And so Taylor, now that you're, in this new position and you know, wanting to sort of keep things moving. We're still in the midst of a pandemic, obviously, but I know you have big plans moving forward, and I'm wondering if you can talk about some of those.
Sure. So yeah, as I touched on, we just recently received official approval to move forward with our ARPA proposal, which I guess we can now start calling our project because it's no longer a proposal. So we're really excited. It's approximately $11 million to guide us over the next few years. And to improve nutritional security, food access, and food equity in Baltimore, as you said, during and hopefully eventually after COVID-19. So what we think is really innovative about this project is that it's a comprehensive project looking at our city's entire food system. It's not just one project in one community. So we have 5 different pillars that will guide our work. I'll just mention them as quickly as I can, and then like myself, Lindsay, or Yewande can go into more in depth on any of them. But one is to continue the produce box distribution efforts that are ongoing now. And because we know that, you know, we've been distributing produce for 2 years, and we know that residents want and need and have really valued the produce, and we've been able to prove that. A couple more numbers related to that I didn't mention earlier is that so far we've distributed the equivalent of 171 million servings of fruits and vegetables to residents in our city. So we obviously want to continue that. And we've been able to invest over $15 million to date in local and regional farms through procuring this produce. And so we're focused on continuing those investments in the future as well. The second pillar is to increase online SNAP participation in Baltimore City by 50% over the next 3 years, also with a focus on digital equity and outreach about online SNAP, since it's still a relatively new program. The third pillar is to increase produce incentives at farmers markets and to transition the incentive program in our city from a physical token program to electronic incentives. The fourth pillar is to implement a Produce RX, or Food as Medicine program with MedStar Harbor Hospital. And the fifth is to increase and secure our BIPOC local food supply chain. And the main part of that work is to work with and give $1.5 million towards the Farm Alliance's Black Butterfly Urban Farming Training Program, and specifically for infrastructure at their farm incubator site.
It's such an amazing pillar, or 5 pillars, such amazing 5 pillars. Lindsay and Yewande, resilience is embedded in each of these pillars. And I want you, if you both can talk a little bit about why that 5th pillar, the BIPOC local food supply chain, is so important to improving the resilience of Baltimore to not just what we're going through now with COVID-19, but future global shocks. Lindsay, if you want to go first, or Yewande.
Yeah, I don't mind going first. I mean, as many panelists have mentioned, it's putting money and power into the hands of people, especially some of our BIPOC growers here in Baltimore City. They're developing a beautiful training program, so they're training individuals at a young age, teenage years, and being able to invest in their future to grow food. We're also investing in the infrastructure, so developing out this training program and developing out these farms. And so really it's just placing money into the hands of an organization whose work we really believe in. I think that's the main piece from me. Yewande, do you want to add anything?
I'll just say a lot of the farming work too is just like definitely connected to other pieces, especially like with the youth. We have a lot of youth that do a lot of work with the farming, so they actually get to see where their food is coming from, which is very exciting.
Thank you both so much. Holly, I want to turn back to you for the last part of this panel. You know, you put a lot of what we've been talking about into place in Baltimore, and you should be commended for that. And you have this amazing staff who will carry many of their own ideas now forward. You're at the Milken Institute, and I'm wondering how you're using what you've learned at, in Baltimore as part of city government to now, take this into a different sort of space and maybe onto a global level.
Great, thanks, Danny. So what I learned in Baltimore is two key things. One is the direct correlation to food insecurity and poor health outcomes. So putting that into a positive light, right, is that by providing produce and helping people become more nutritionally secure, it has direct health outcomes. So one of the key things, and I was with the city for 12 years, and I'm now with the Milken Institute for 3 months now. I just hit my 3-month mark this week. And so the reason I left to go to Milken was two reasons. One is food is medicine. We need to move public policy so that food is not only considered a social determinant of health, but it is treatment. It should be part of healthcare. It should be a benefit that is covered for diabetic and other diet-related diseases, so that if a food insecure person has a disease and a doctor or a healthcare worker says, eat more fruits and vegetables, well, that they would get a prescription to do so. Medically tailored groceries, or with produce. And so the way that we're doing that at the Milken Institute is I'm working as the lead on the Food is Medicine Task Force with 15 insurance companies and 10 retailers to help transform this system. And a lot of this is learnings from Baltimore and seeing, one, people really are eating produce. Price and access and availability are significant barriers. So that is one key lesson. Another piece is the first day I worked in the city of Baltimore, in my first week, I started working on online SNAP, Supplemental Nutrition Assistance. It took 11 years. So 2 farm bills, multiple pilots, and then it finally rolled out due to a lot of pressure during COVID-19. And so what we learned in this process with online SNAP is that it really takes the barrier of the brick and mortar away, right? So that, however, we want to make sure it's equitable. And it's rolling out now, and we have a chance to change what that could be. And so one of the things that we learned in Baltimore is all the retailers, the key retailers that have been approved in the city of Baltimore for online SNAP, and I think Lindsay can speak more to this, will be getting nutrition incentives for our produce. And one of the things that we want to see is that's the now. Well, what's the future? The future is when we have produce prescriptions coming down the pike, making sure we have the technology, the retailers, and the systems and the community-based organizations all ready and prepared to roll that out. So that's another key piece that I'm working on to my role there.
Absolutely. And I could talk to the 4 of you all day, and I could talk about Baltimore all day. We're out of time. Thank you all so much. Taylor, again, congratulations on your new role. And thanks to all of you for the work that you do for the world. It's really very inspiring. Thank you so much. Let's give them a round of applause.